How can we foster more of that innovation from the inside of healthcare, getting more doctors, dentists, nurses, dietitians involved in that systems change and involved in that bringing things to the next generation?
Yeah, I think it comes. I think it to me it comes. I go back to maybe my Princess Margaret Hospital days back in 1992 to 1997, where, as I said before, Jordan, that innovation research culture sort of greets you at the door and draws you in, right? It makes you part of the. You have to have that curiosity and experience. I think our what are for innovators that are professionals out there, I'd say there's really no harm in two things. Number one, giving the Alberta Innovates staff a call. Call me, call my team, reach out to members of my team, have a conversation, because I think a lot of innovation starts with the needs of the healthcare providers, but it also starts with a conversation with where we might be able to provide some funding, some support, some referral on to another group, to another partner, what have you. And the second thing, Jordan, I'd say is what we're trying to do, what we have been doing, and what we've been done quite successfully is we have a signature conference in Alberta. It's going to be May 29th, 30th, and 31st in Calgary, which is called Inventures. And the whole goal of Inventures is to have creative collisions amongst professionals. So it's basically the physician talking to the artificial intelligence expert researcher, talking to the postdoctoral fellow, maybe talking to the dietitian, and then striking a sort of a project or an idea. And those creative collisions are really important. We'd like to foster them, not just there, but a year round, but that is our one sort of touchstone event. Last year, we had 3,500 people attend Inventures, and this year we're anticipating about 4,500 people attending Inventures. So I would say those are two vehicles, Jordan, that I think, plus all the other events that we have throughout the year, to get involved. And I think, to me, it's like leadership. You've got to put your hand up. You got to have a conversation to get going. I think that's one way, Jordan, to get into the innovation space and create that curiosity, which I think leads to a learning health system where we can actually get to a tipping point where we can make a change in our health system for the better.
I love that. Just creating those connections and then networking. Because I get like fairly regular messages from doctors that are interested in technology, interested in innovation. Some of them have an idea of what they want to do. Maybe they've got their own project they want to launch, but there's many that just are like, I'm kind of techie. Like, do you know who to point me to or where I can go to start connecting and, see what's actually out there? So Inventure is probably a fantastic spot for that, checking out all the different vendors, the different speakers, and just seeing if there's anything that resonates.
Yeah. I mean, the one thing I'd say is that it's the one learning I have in this role in relationship to my team as we learn, it's more than the technology. So there's more than just the tech. A lot of people have good ideas and good tech, but it's how it meets the needs of the system and how it fits in. So what I see a lot of is a lot of what I would call technology point solutions that may work at one point in the client patient journey, but really do not work upstream or downstream or disrupt the workflows of the healthcare team as they assess that patient. So not that in and of itself that's a bad thing, but you have to understand that it's changing the models of care, changing the mindsets, and then bringing in the skill sets to use the technology. And then the technology itself is in the tool set category. So it's that expression, Jordan, from Stephen Covey, mindsets, skill sets, tool sets, in that order. And we have to start thinking about that around health system transformation as we move forward.
If you were to go back and do it all again, is there a particular project you would work on? Something in the cancer domain or otherwise?
What I work on? No, I'm very happy. I mean, I was able to, one of the projects from the Princess Margaret Hospital was the re-engineering of radiation therapy. And that we had all the tech at the time. That wasn't the challenge, but what we had were professional groups that didn't work well together as well as they could have optimally, right? So the radiation therapist, the clinical physicist, and the radiation oncologist. And then I also was able to bring in advanced practice nursing into that realm, and that was a really good. That improved the quality of care. So that's one I always look back on that I think we achieved the cost savings of the project. So we were able to save $1 million a year. We were able to increase the throughput by 20% on the learning accelerators. But most importantly to me, not that those things are unimportant, but we were able to bring in advanced practice nursing to the radiation oncology radiation patients, and that was able to increase the quality of their care experience. So that really was the quintuple aim, I think, from my point of view, in being able to do that. So I wouldn't go back and do that one over again. I'd like to see that continue on, that mindset shift as we go forward in healthcare, because we still have large problems in the healthcare system. But I think collectively we have to get out of this problem. And my other thesis, Jordan, is that we have to, I'm pretty sure we can't spend our way out of this problem. We can't hire our way out of this problem, because again, those numbers from the World Health Organization would indicate there's going to be some headwinds to hiring. But the thesis is we have to innovate our way out of these challenges, right? So we have to find innovative ways to work with models of care. And then we have to have tech support the new models of care for better health outcomes.
Yeah, I wish it was just single variant, something that we could use or spend or do differently to like really improve the healthcare system for everybody. But it's unfortunately frustrating that it's just so multifactorial and everything has to come together sort of in that beautiful symphony and work together. I guess before we wrap up then, do you have a health tip? What is your number one thing for people out there listening in terms of how do you keep your head on straight? How do you manage stress? How do you keep your body moving? What's the secret?
What I do, I don't know if it's for everyone, but I do play ice hockey with two teams in Edmonton. So I play with a pickup group on Monday evening at the CAC rink in northern Edmonton, and then I play with the Tornadoes, another group. We play league. We play around the city, so I do that. That helps with work-life balance. It helps with exercise. I think the second thing I've done in the last 8 years that's helped my work-life balance and stress is I've joined a book club. So I've been able to read about 7 or 8 books that I probably wouldn't have read otherwise. And so it's a good group of guys. And so I'm just starting to get into that space as well, which is interesting because it helps apply. You read a lot of books that help you can apply in your work life too. So you take a lot from those things. Plus it's good conversations and good fun with the guys. So I enjoy that. So those are 2 things, Jordan, I do. I don't know. Everyone's different. So everyone has to find their own way they deal with stress, especially in this environment, right? There's a lot of things changing, and change brings stress. So we have to find ways, I think, to manage ourselves, because this is going to be a long-term exercise of system transformation. It's not going to be a quick linear path to the solution, but it does take a collective effort by everybody to get on the same page. And I think that's one thing. If I could wave a magic wand for healthcare, if we can get everyone on the same page, I like our chances better for change than if we work in silos or we work individually.
A very Canadian answer, the therapeutic benefits of hockey. And I do hope that we're able over the next coming years to get everyone on that same page and working together towards those shared common goals. I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.